Welcome once again to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Jon, and every week I'm chatting to Dr. Clifford Yudelman. We take a nice deep dive into the world of dental care from a consumer's perspective. So whether you are looking to brighten that smile or protect your wallet, we have got you covered with practical advice and the latest insights. Stick around as we uncover the secrets to maintaining both your dental health and also your finances. Today's topic, dental inlays and overlays. We're going to ask Dr. Yudelman to tell us all about it. Dr. Yudelman, once again, welcome back.
Thank you. Thanks very much for having me back, Jon. I hope you had a great week and lovely to chat to you again.
Likewise. So, Doctor, what are dental inlays and overlays? How do they actually differ from traditional fillings?
So when you have a cavity in a tooth or you have an old filling and we take the filling out, if the tooth is still quite well preserved and all you're doing is filling something in, with a filling, then a filling is usually the way to go. But once the filling starts getting to a larger size, then we start looking at dental inlays or overlays, or some people, we call them onlays. So inlays fit within the cusps. So the inlays are placed in between the cusps of the teeth. The cusps are the pointy bits. Overlays cover the cusps or one or more cusps. They are custom made and precision. They're made to fit the tooth's exact contour. So how if a tooth is cleaned out, you put a filling in to the tooth. An inlay or onlay is made outside of the mouth and then it's bonded. We'll get into that shortly. They have superior strength. They provide better strength and durability compared to traditional fillings. And they're more aesthetic. They can look better and blend seamlessly with the natural teeth.
So when should I consider getting an inlay or overlay?
So a patient should consider getting inlay or onlay instead of a filling or a crown when there's extensive damage. So when the tooth damage is too extensive for a filling, but not severe enough for a crown. So I'm very keen on inlays and onlays. I really don't like doing crowns on molars. At OptiSmile, we really try to save as much of your natural tooth as possible. And while, 8 out of 10 dentists might say, oh, that's got a big filling, we're going to do a crown on it. Doing a crown necessitates removing a lot more tooth. And while a crown might work, we worry what's going to happen in 10 or 15 years' time if and when that crown fails, you've got even less tooth. And inlay or onlay saves more of the tooth. So that's when you've got this extensive damage. When there's decay or fractures, inlays and onlays can work really well. If you've got a tooth that's got a big filling and part of the tooth is fractured, you can do an inlay and then you can just overlay or onlay the one cusp that's broken. I mentioned, they've got a more natural look. You're not just putting a cap right over the tooth. It's actually getting the tooth back to how it used to look. They last a very long time and it preserves the tooth structure, like I said, whereas a crown, you're filing away a lot of tooth.
And Doctor, can you talk to us about the steps involved?
Yeah, so the dentist would look at your tooth, take some photos, take x-rays and diagnose, okay, this tooth needs a filling, this tooth is fine, this tooth needs an inlay because the filling is really large. We could do a filling, but it may not last as long as an inlay, so we recommend an inlay. If you've got a dentist that's recommending lots of inlays, I would ask the dentist, are you sure you can't put a filling in there? Because the fillings are getting better and better. And if the tooth is at an inlay stage, to be honest, a lot of time a filling may work and the inlay could be an unnecessary expense. But the thing is to ask the question. And if the dentist hums and haws, then maybe go with the filling and see how it goes. But when you get to the point where you need an onlay because you can see the side of the tooth is missing or the tooth has a crack, that's when you want to go with the onlay. So that's part of your examination and diagnosis. So you would come in, we would numb the tooth. We use a scanner, an iTero scanner, an Invisalign iTero scanner, or an Omnicam, a CEREC scanner, digital impressions. We use CEREC technology. It's a CAD/CAM machine for making inlays and onlays in the practice. It's like not quite a 3D printer. It's called CAD/CAM, computer aided design and computer aided machining. If a dentist doesn't have that in the practice, then he has to put a temporary, and then you would come back. The labs are all making the inlays and onlays using CAD/CAM at the lab. So the process is the same. It's just we do it in one visit, whereas other dentists may put a temporary in and then do it in 2 visits. And then you would fit the inlay or onlay to the tooth. You try it in. You take it back out. You prepare it. You put special chemicals on the tooth and on the onlay, and then you bond it into place. Then you check the bite, polish it up, and get the patient back in a day or 2 just to double check everything, that all the cement is clean and that the bite is good. Yeah, they work really well. We've done hundreds of inlays and onlays. OptiSmile, we're in our 10th year. And if we get 1 or 2 patients a year come back because of a problem with the inlay or onlay out of literally hundreds, if not 1,000, it would be a lot. We really don't see problems with these.
Okay, and in terms of preservation of tooth structure and overall dental health, how do the inlays and overlays contribute?
So like we said, minimal removal of healthy tooth material. I'm super conservative. When I take out the filling, I smooth off the edges and I just change the shape a little so that my CEREC machine can mill the inlay. I'm very careful not to remove any more tooth than needed. And a lot of other dentists are like that as well. They strengthen the tooth by fitting precisely through the damaged area, and they seal very tight. They reduce the risk of further decay, maintain the integrity of the tooth by bonding to the remaining cusps, and they also help to prevent further damage and complications in the future.
Okay, and then in terms of materials, what materials are used for dental inlays and overlays, and also why are they preferred over the traditional materials?
So traditionally, inlays and overlays were done with gold, which do last a very, very long time. But gold is not very popular these days. People don't want gold showing on their back teeth. So since 2007, we've had a very durable material called EMAX, which is a lithium disilicate. There's now other lithium disilicate materials available. We use a lot of what's called LISI, LISI, which is short for lithium disilicate. It's an amazing material. They provide a perfect color match. They're very strong. They bond to the tooth. They're known for their long-lasting strength and resilience. They're biocompatible with oral tissues. There's no adverse reactions. And they look amazing. They look better than gold or those silver amalgams. We used to make them out of something called feldspathicate porcelain back in the early days before EMAX. In fact, I've had some of those earlier, weaker ones in my own mouth for almost 20 years. We've been using CAD/CAM. I was doing these in Perth in 2004. I was starting to do them. And I had some done in my own teeth, and only just recently did one of the dentists in the practice replace 2 of them for me with a newer material. I got the LISI blocks. We use a little block, and the computer mills the block into the shape of a tooth. It takes about 8 to 10 minutes for the computer to make the inlay, and then we polish it up and glue it in.
It's amazing technology. And now we're going to carry on with technology because we're talking about advanced technology. How does this advanced technology like digital impressions and CEREC enhance the accuracy and efficiency of inlay and overlay treatments?
So the precision of digital impressions these days surpasses the traditional, the goopy stuff that we put in your mouth and then we wait for it to set and then we take it out. There can be a lot of human error. Maybe the assistant doesn't mix it properly, or the dentist doesn't leave it long enough, or it's a very cold day or a very hot day. Whereas the digital scanners are very, very accurate these days and very precise. If a dentist has a CEREC same day, the efficiency is amazing. So you get the inlay or onlays made the same day and placed. So if you need 1 or 2 of these, you come in, we scan you, we numb you, we take out your filling, We make the restorations, we bond them in place, and 2 hours later you leave with a permanent restoration. There's no multiple appointments, there's no temporaries, it's more comfortable. You don't have to have more numbing the next visit. They customize, for a perfect fit, and it reduces the likelihood of any human error in like traditional methods of making inlays and onlays.
And then how do inlays and overlays actually enhance the overall aesthetics and functionality of a patient's smile?
That's a great question. So a lot of the time, upper molars have got big, dark amalgam silver fillings in them, and the amalgam shows through the side of the tooth. And if you see a dentist that has a similar philosophy to what we have at OptiSmile, that wants to preserve most of your tooth, rather than filing the whole tooth down and covering it with a crown, a lot of the time those crowns don't look or blend seamlessly with your tooth. But if we take out the filling from inside the tooth and all the grayness is gone, and then we put the inlay or onlay inside the tooth, and it's got a natural high translucency, the tooth just looks like a normal tooth. In fact, sometimes when we're done, you look at it or you take a photo and it's hard to see what's tooth and what's inlay. They really blend nicely. You got improved, so there's the seamless integration, there's improved function, it restores the functionality. You can bite on them right away. It's durable, long lasting. They can last 10 to 20 years and maintain the tooth's original structure and appearance. And it boosts your confidence because you've got a great smile, and the patient is more confident without all those dark black fillings showing.
Doctor, the difference between inlays and crowns, can you tell us more about that?
Yeah, so inlay and onlay, fit into the tooth or just replace the missing bits, whereas, as I said before, the crown covers the entire tooth, which means that once the dentist drills all the way around the tooth, you got to decide where to finish the crown. And a lot of the time, we want to finish it at or just under the gum line. So we got to then push a piece of string or retraction cord and push your gum out of the way. And then the gum can bleed and be sore, or we have to laser your gum, which if we concerned about the lab or the digital scanner being able to see the edge of the crown. Whereas with an inlay or onlay, it's less invasive. Like we said, if a tooth is really completely, there's hardly anything left, then you have no choice but to put the retraction cord or laser the gum, prepare the whole tooth, scan the whole tooth. And the CEREC, you can make a crown same day as well. So if someone comes in with a crown already on a tooth and the crown has now got decay or it's come loose, we can do a crown the same way. It's basically you choose between them depending on the extent of the damage. But in keeping with the theme of save your money, save your teeth, anytime a dentist tells you need a crown on a molar, I would always ask him, what about doing an inlay or an onlay would generally be more suitable? Do I have to have a crown? Like I said earlier, I'm not a big fan of crowns wherever possible. I think inlays or onlays are better.
And then how long do these dental inlays and overlays typically last, Doctor? And maybe you can also give us some tips there on what factors will influence how long they last, and also in terms of durability.
Yes, so the high quality materials like Emax can last very long. In fact, Emax, they've done literally tens of millions of restorations worldwide. It's a famous material. Emax has been used in millions of restorations worldwide. Emax used to come with a 5-year warranty against breakage from the manufacturer. They've increased that to a 10-year warranty. They're so confident if it's more than 1 millimeter thick that it won't break. You can pull them out if they're not properly bonded and the dentist doesn't follow all the correct procedures. If someone pulls it out on a very sticky toffee or something, they can be cleaned up and re-cemented. So that increases their usage. Oral hygiene is very important. Regular brushing and flossing is important because you've still got your tooth, so you can get a cavity next to the inlay or onlay. You want to have routine dental checkups to ensure that all your fillings and crowns and inlays and onlays are looked after. And then the precision of the placement is crucial in their longevity. If a dentist has poor equipment or does a bad impression, or the lab is a bit, if the dentist is using a really cheap lab or sending them somewhere overseas and the work isn't great, then they're not going to fit very well, and they won't last very well either.
And doctor, our final question for today: what should patients expect during the recovery process?
That's a good question. Normally, when we do them in a single visit, the anesthetic wears off and the patient can eat and chew like normal. There can be mild sensitivity to very cold things, especially if you were taking out a big filling or the tooth had a crack or some issue before, and you're putting chemicals on the teeth and rinsing it off and then sealing it. So mild sensitivity is I wouldn't say common, but it can be expected. If someone gets an inlay or onlay and it's fine the first and second day, and after 3 or 4 days it starts to get more and more sensitive, it means that they need a bite adjustment. I always bring patients back in the next day, or if there's a weekend, we bring them back in on the Monday just to check their bite, because when they're numb, you can't always bite properly, and it's important just to make sure that it's biting evenly. You get an immediate function improvement. So a tooth that had a big filling that was broken, or it had poor contour, we've built it up to its proper shape and contour. And a lot of the time it's because people have a food trap. There's space between the teeth. Inlays and onlays are great for those. If someone's had a big filling replaced 2 or 3 times and it keeps breaking, or the dentist can't stop the food from getting stuck there, that's when you want to ask the dentist, hey doc, what about an inlay or onlay here instead of another filling? Yeah, follow up care and learning how to floss properly helps it to last longer. Coming in every 6 months or every year for oral hygiene, and getting your checkups, those are all important and things that we've discussed before. That's to help any of your dental restorations last. But wow, you had some really good questions there. Thank you.
Thank you to you, Doctor, once again for sharing your expertise with us. We really, really appreciate it.
My pleasure. And hopefully people listening to this don't need too many inlays or onlays, because they are expensive. The equipment to make them, or the laboratory fee alone can be 3,000 to 4,000 Rand. That's before the dentist charges 1 cent. The equipment, CEREC, the scanner and the mill to make a CEREC can cost upwards close to 2 million Rand or more. And so if a dentist is doing 1 or 2 of these a week, or 3 or 4 a week, it can take 5 years to pay that machine off. So there's going to be a cost involved, which is obviously passed on to the patient. So people need to understand that the best inlay or onlay or crown is the one you don't need. Floss every day. Make sure if you have got smaller fillings that you look after them, they don't become bigger fillings, or that if you have had a bout of cavities and they've all been fixed, look after your teeth so you don't end up with too many expensive inlays, onlays, crowns, root canals, implants. These things, if they're done properly, can be very pricey, and the best thing is to avoid them.
Exactly, and that's another edition of Save Your Money, Save Your Teeth. Remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe also for more enlightening discussions, and then join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.